Overall, rates of antibiotic resistance appear to be increasing for the U.S., although we do not have a complete picture of resistance. There are several large surveillance networks currently in place gathering data to specifically address this question. The most well-known are the National Healthcare Safety Network, or NHSN, and the Surveillance Network, or TSN. Both are collecting culture data from hospitals and other laboratories from around the country to monitor trends of in vitro susceptibility. We get a peek into certain resistance trends when this data is analyzed and published. The most recent report from the NHSN database looked at cultures from 2009 and 10 from over 2,000 hospitals reporting 70,000 healthcare-associated infections. There were 8 pathogen groups that accounted for about 80% of the reported infections. When they compared these 2 years to the same data reviewed from 2007 and 8, there was a slight tick down in the amount of resistance with the gram-positive organism Staph aureus, or MRSA. However, there was an increase in the amount of some resistant gram-negative pathogens, including newer, scarier, carbapenem-resistant Enterobacteriaceae, or CRE. In this report, CRE appeared in nearly 1 in 5 hospitals. CRE can result in significant resistance in many gram-negative pathogens, including Klebsiella. 2 reviews published in 2013 specifically addressed Klebsiella resistance trends, but used TSN data this time. Both looked at more than 10 years of culture data through 2010, and both studies noted an increase in antibiotic resistance. The first found specific increases in carbapenem and cephalosporin resistance in all regions of the U.S. The second study found Klebsiella resistance increased for every class of antibiotics studied except tetracyclines. E. coli has also been analyzed in 2 studies in the past year for resistance using 10 years of data from TSN. E. coli is significant since it's the most common organism in UTIs. Both found significant increases in quinoline resistance, like ciprofloxacin and levofloxacin. The first study found an overall increase from 3 to 18% of quinolones from 2000 to 2010. The second study identified that geriatric patients had a significantly higher risk for resistance. The most significant increase was specifically in ciprofloxacin resistance from about 9% to about 24%, again looking at data from 2000 to 2010. Theories behind increasing resistance have a common theme of patients exposed to multiple or prolonged treatments with broad-spectrum antibiotics. If we can curtail unnecessary use and minimize broad-spectrum antibiotics through antimicrobial stewardship, we can perhaps make significant improvements in resistance. In general, we may be making progress in the gram-positive realm, but losing significant ground with the certain gram-negatives and antibiotics. The CDC is hoping to encourage stewardship via $30 million allocated in the most recently proposed national budget. The CDC would like to open specialized labs in several parts of the country to help diagnose and combat resistant organisms faster. Additionally, the CDC wants every hospital to implement a program to track and improve how antibiotics are prescribed. These resources could drastically reduce the number of Clostridium difficile infections and minimize resistant organisms. Antimicrobial stewardship is absolutely essential to promote optimal antibiotic use and minimize collateral damage such as resistance. We will have to keep a close eye on resistance trends and adapt our processes based on results.